My name is Jaime, and I am the infection prevention specialist for Telegen. We're going to have a great time today. We're going to talk about influenza virus and other virus during the pandemic. But before that, we're going to have some. Hi, Jennifer. Welcome, welcome. So we're going to have. First of all, we're going to start with an icebreaker. And while I was practicing, I was calling it outbreaker for some reason. I think my infection prevention thought just got in the way, and I was kind of afraid to call it outbreaker versus icebreaker. So we're going to start with some disclaimers from Telegen and how to contact us. These slides will be provided to you guys for your convenience, and I will place my email in the chat so you can send me any questions or any concerns that you have or topics that you would like to cover during this conversation. Just FYI, I'm here for you guys, and I'm sure all the entire intelligent team is here for to assist you in any matter. So please put your concerns in the chat and also any questions that you may have. So this is cool. This is a infection prevention icebreaker. Two truths and a lie, right? So we have two main issues, two main topics: surgical face mask and surgical gloves. Please pay attention to the pattern. Infection preventionists does not believe in words or actions. We believe in patterns. So this is really important for us. Hey, welcome, Teresa, Horizons. Um, Surgical mask. So you're going to find what is a lie. Face mask were originally developed to protect patients from wound infections. Protection is about 8 hours, and they are made up of 3 or 4 layers and 2 filters. Please place A, B, or C, which you consider is a lie. You have a few seconds to place there. Hello, Lori. Hey, nice. Mary, thank you. Hey, that is the lie. Ooh, nice. There's no right or wrong answers. Hey, Trisha, thank you. Um, keep going, keep going. Don't be ashamed. A, B, or C. Nice. Nice. C. Nice, Lori. Thank you, everyone. Thank you, Teresa Tracy. Whew. I wish I could send you a virtual present of, you know, for your answers. Here we go. The were originally developed to protect patients from wound infections. That is true, 100%. Okay, and I'm going to show you. It was initially started with a French surgeon. His name was Paul Berger, excuse my French, and he put together. Let's see if you can see here. Can you see it? Maybe a little here, or I saw that. Can you see that? That's kind of freaky. They started with gauzes. So they put 6 layers of gauze and they started using the masks. It's a French surgeon who started. Let's see this one. You don't see. So what they did was they put layers of gauze and they put it in their mouth and nose and tie it to the apron, the sterile apron that they use for surgery. It happened that one of their students noticed that when they were in the amphitheater with an open abdomen person, when they were teaching and talking, there were some droplets going into the wound. And Paul said, "Hey, no, I don't think it's a good idea to spit on someone with an open wound, right?" So they are made up, our surgical face masks are made out of 3 or 4 layers and 2 filters. That is correct, right? Droplets going into wound. Yes, droplets going into wound. That's how we started. Protection afforded is claimed to be 8 hours. For level 2 surgical mask or level 3, the protection goes from 4 to 6 hours. because of the humidity that we produce through our mouths and noses, and also the droplets when we talk. So advise your staff when they go for lunch, has been probably 4 hours since they arrive to your facility. They go for a break for lunch. Make sure they change their masks because they protect up from 4 to 6 hours. Level 2 to level 3 surgical mask. Good job. Thanks. Let me clap for you. There are some cool features here that I can use so you can receive some claps. Thank you so much. The next one, surgical gloves were originally developed based on a love story. We're looking for a lie, remember. Were originally created by Goodyear and replace hand hygiene. You have 5 seconds to put in the chat A, B, or C. C. Good job, Lori. Jennifer, awesome. Oh, you got it right, guys. That is great. Fantastic. Thank you. This went really fast, right? Awesome. You can use these type of items to start a conversation. Uh, Mary, thank Mary. Yes, the lie is C. Gloves does not replace never hand hygiene. Hand hygiene is the number one way to prevent infections. And you want to see the first pair of gloves ever used in I know, I know. Don't get a heart attack. Let's see. Okay, look at this. Can you imagine how many times they were used in surgery and perform hand hygiene on top of them? Uh-huh. Yep. That's the first pair of gloves. Was it developed based on a love story? Yes. The father of surgery, William Halsted, they are made of rubber. Yeah, that's the material, Mary. They were first made of rubber. So it was based on a love story, and it was William Halsted was the father, is considered the father of hand hygiene. He had an assistant whose name was Caroline, and they noticed that Caroline was getting her hands damaged. So they said, hey, let's order it via Amazon and see what comes out. So Goodyear at that time was the rubber company, and they created the first ever pair of gloves to be used in surgery. Looks like snow gloves or something like that. Um, so you know, nice. You can take these points and have a conversation with clinicians, with nurses. That's how I started some conversations with difficult people. Do you know who the father of hand hygiene is? Do you know when was the first time and who created the first pair of gloves, surgical gloves? So as you see the pattern, surgical mask, surgical gloves, this is the contribution from our surgeons to this. So this is the origin of face mask and also surgical gloves. Nice. Thanks for playing. This is awesome. You learn a lot and you learn it from me. Intelligent. Thanks. Next slide. So now we're going to look into patterns, right? So during the pandemic, during respiratory season, we have 5 different type of viruses that we have to deal with. Respiratory viruses. So we're talking about rhinovirus, adenovirus, human metapneumovirus. We're talking about coronavirus now, and also different other viruses. So I said, let's pick one of them that is being well monitored, influenza virus, right? So I went into the CDC website and I found an interesting data. So you have in front of you, you have week 52 from 2019 to 2020. You have week 52 from 2020 to 2021 and 21 to 2022, right? Interesting. So we're going to look at the pattern here. What do we see? Okay, it's the same week. We see that is the map of the United States. And we see that this report is a summary report for influenza virus activity, right? So you have in the same week, but different years. So the weeks 52 from 2019 to 2020, we were reaching a very high level of occurrences or incidents or flu activity, right? You start thinking why the middle is looking like a broccoli. Why is the middle map looking so good and green? So we have 2020 to 2021. You can start chatting and say, why do you think this is the reason? So it turned green, which is a very moderate to low activity. And in 2021 to 2022, it's kind of burning. Mask mandates. Thanks, Anitra. You're right. So, right. So you see the difference. You see the pattern. Isn't this the middle supposed to look like the others? It's the same week, the same period of time. This is December. This is almost the end of December. So what happened, it was the extraordinary measures that we implemented to limit exposures of coronavirus also impacted other viruses, especially the flu, right? Social distancing as our behavior, social distancing, the masking, the hand hygiene, and all the preventative measures that we use stop the incidence of flu and other viruses, right? That's why we see this in the map. Next slide. There are some reference there for you to have to to share, or if you want to look into. So this is week 22. So a little after. So we expect the flu season being from, October, starting fall, and all the way up to February, March. You see some cases in March. So week 22 from 2019 to 2020, we were under the pandemic mode, right? So remember that we started the pandemic in March, end of March. So in May, because of the massive mandate, stay home, use your mask, don't gather, things like that. So look at the graph. Look at the first week 22 in May. It was green, no flu identified. We maintained the same colors for the following year, 2020, 2021. We were still with the measures, with the extraordinary measures. But what happened the last year, 2021, 2022, right? We started loosening up the regulations. So masking mandate was not like, social distancing was kind of loose a little bit, was relaxed. But what happened in week 2022, which is June? We don't used to see influenza viruses in June, not even in April, right? Or May. But we are seeing cases of flu, right? Can you see this one? So what had happened, the flu and other respiratory viruses have come out of season. So now the season that we used to think, oh, this is flu season, no longer is going to be a flu season. So we're going to keep having cases off season, right? So at this point, coronavirus does not have a season. It's trying to make its own season, but the flu, so we always get ready when the flu season comes, right? Vaccination campaigns, and people relaxed like about April or May, because there's no flu. But now this is changing. I just want you to know that the changes reflects the shifts in our own behavior during the pandemic. So this is changing with, trying to protect from coronavirus. We also protect it from other viruses to be spread. You see, Florida has a fourth of the entire nursing home population in the United States and is extremely high in flu incidence off season. This is June. The week 22 includes June until June 4. And it's having some flu cases. So you have Nevada and also I believe that is New Mexico or something. People are traveling and not masking. So we're seeing new cases of flu in off season, right? Next slide. So yeah, my question is, what is your facility doing to stop the spread of viral infections? Right? You can chat it, we're gonna go over those ones, right? One of them that we just talked is hand hygiene, right? We try to implement hand hygiene prior, after, every second we can, so we spread the transmission of any virus diseases, or effective masking, making sure that everyone is using the masks, like not just covering the mouth or leaving the nose, uncover. Mask hygiene and vaccinations. Guys, you're awesome. Yes, vaccination is going to be my next item here. So effective masking. So if you've encountered um, difficult people that are not wearing, the right masks, and also properly, make sure you coach them. You can start with, do you know how, when do we start using masks and things like that? The items, some of the beverage that some of the words that I just gave you in the icebreaker. So you can start using it just to encourage and engage people into conversation on how to wear the mask properly. I've noticed some people taking the mask off when they wanted to sneeze, or taking their mask off when they're coughing. Um, that's the rationale why we're wearing masks, so they can cover the cough and the sneeze as well. A strong vaccination program. Make sure, you already mentioned it. Make sure you have a strong vaccination program. What does it mean? Um, Number one, get your own vaccine. You as an IP are the role model. People are going to find um, you as a role model, and they are going to want to follow. We do a lot of education. We have also mandated the flu vaccination. So we have 100% compliance. We want more of you. And this is the space to share this kind of information. Thank you so much. And you have and you can share it here in the chat, and people can ask, how come you reach that level of compliance when my facility is doing 70%, right? The goal is to reach 100%, and this type of space is going to help us share ideas, strategies. What can we do to increase our compliances, right? One thing that I would like, especially now, a strong vaccination program is really important. So, okay, what's going on right now? The gas price is going high, right? People are carpooling. Probably, I hope, with the windows down, and if not wearing masks, people are starting carpooling because of the gas prices. People are gathering. Most of the COVID exposures are coming from our community. So our staff is getting, the virus SARS-CoV-2 outside in the community. So make sure if they are carpooling, make sure you wear a mask and also lower your window down. Um, Make sure your house has a nice ventilation system. If you're going to have visits, bring HEPA filters into your home and place it strategically close to the dining table or close to wherever you're going to have these people seated. Um, and if you're not wearing masks, especially. So the CDC has a cool tracker on they advise you how to, and I can put it in the chat, and they or send it to you later if you ask for it. It's for homes, so you can put, how about if I put this ventilator, or how about if I take this measure? It gives you the risk of exposure, if any, right? It's very cool. It's called a COVID tracker. And if you ask me, I'm gonna send it to you. So you have my email in the chat. So let's do that. There is a question in the chat. If you can help me, Heather, with that one. I can't see it. Is there a website available to check vaccination status for employees and residents having difficult tracking status good point. Um, for, I don't know your Department of Health. Usually in Illinois, there is a tracking system that IPs have access. Contact your local Department of Health and they would guide you if there is. I'm 100% sure that they have a tracking system in which you can look up the residents and see how compliant that person is. Um, Here in Illinois, we have a tracking system for that. Yes. So contact your local department and see if they have. In Oklahoma, we have OCs where everyone's vaccines are entered. Yes, that is true. Cool. Yes, I'm 100% sure that they have a tracking system. So cleaning, that's another piece. Cleaning and high touch surfaces. We're almost close to the end and I want you guys to have ask some questions. Cleaning, high touch surfaces are really important. Some microorganism can last for several hours in your facility, in in the patient's or residence area. So make sure you are thoroughly cleaning. There was a conversation going on in the conference where they were proposing to clean, to do high touch cleaning after some care provided to the residents or patients. Like if let's say the resident had number 2 and we had to go and clean it. So you do as a nurse aide or as a nurse, you do your task, get everything clean, linens changed and everything done. And it was recommended to go ahead and do high touch cleaning to reduce the burden of potentially microorganisms that could have been landed in the in surfaces, high touch surfaces area. So that is something to come. I don't think it has been approved, but I would encourage if that happens. Says Kathy says yes, and it is only good as the people loading it to the website talking about the vaccines. Nice. Okay, great guys. Look at you. Thank you. This is the purpose of this space for you guys to share and have some ideas on what to do at your own locations. So high touch cleaning is really important for the spread of infection. So let's get it. Let's try to do more thorough cleaning at our facilities. And another piece that is really important for co-transmission is clutter. Please make sure your unit is not cluttered with things. The, the emptiest, the better. Because if me as an environmental service want to go and clean and I see your resident has a tent because he did camping last night, I less likely will go and interrupt, right? So I will just postpone. So make sure that the rooms are not cluttered, that are clear for you to access and perform whatever task you are going to do. What strategies have you tried to increase the flu vaccination? This is key, guys. Number one, I told you, I recommended to you to do is get your own vaccine because you have more, people would look at you as a role model and you can say, I got mine too, right? And encourage others to get their own vaccines, right? What other strategies are you using? Just so you know, clinicians are looking into having shots available because of the off season, right? They're rethinking their routines. So they're going to keep preventive shots on hand even during spring and summer because of this viral shift, right? So that is important. Make sure you have, related to the vaccination rates, make sure you have it available. If you can have a standing order, so clinicians says, oh, these are the type of vaccines that we have. Let's make it available to the people. I don't know if your facilities also apply vaccines to family members or visitors that come, and that's another strategies that you, if you don't have, make sure you think of implementing if possible. Everyone in administration was vaccinated as leaders. Yes, leaders are really important so they can set the scenario for everyone to comply with the vaccination rate. We are almost at the end. We have 4 minutes. This has been the most incredible interactive presentation. Thank you so much, guys, for your comments and ideas. If you have any other ideas or questions, we can take some questions from you guys. That would be great. And by the way, just while you are typing your questions, the N95 masks, which is the highest level of protections that we know we're using against COVID, it was created in 1972. And it was implemented as the best practice in 1995 during epidemics. So 1972, N95 masks came after 1897, where the surgical masks were available were invented, right? So do you have any questions or any concerns or anything that you would like to share in the chat? As I said, thank you so much for using the different, yeah, Illinois, I care. Yes, absolutely. So make sure you have your vaccination status up to date. Here are some criteria, what is considered up to date. These slides are going to be provided to you so you can take a look and apply those concepts and criteria. The next slide, Heather. Upcoming events, we have root cause analysis. Our team is awesome at root causing things to get into the really what is causing the issue, right? So make sure you set a time, it's 1 hour, and please register. Plan, do, act. Plan, do, study, act. Also, there is a training, please register and ask the expert. Our next topic is going to be related to another facility I worked in, put anyone who was vaccinated into, woo, love it. There's no better way to motivate an adult than money, right? Or gift cards or something that is tangible. Awesome, that's a good practice. Yes, good job. The next conversation we're going to have is going to be related to UTIs. Please, please don't miss. It's going to be cool. It's going to be really interesting. So sign and register for that conversation as well. Next slide. And thank you. Gracias. Merci. Muito obrigado. 2 minutes. If you have any questions or any concerns, I hope this has been helpful for you. And I hope you can put it into practice. I hope you can kind of have a visualization of your programs, especially your vaccination program, which Telligent will be working really, really hand in hand with you guys on this, how to improve and how to share different experiences related to increase our compliances with the vaccinations. I hope this was very, very helpful to I love the mask. Okay, thank you. Me too. Look, unbelievable. I can't believe it. I can't even see it. Oh, here it is. Look at that. Gauze. Unbelievable. Unbelievable. I know. And also the first pair of gloves, actually. Yeah. Look, amazing. I can't believe it. We were using that for our surgeries. Thank you so much. Thank you, Tracy. And have a great weekend. And I'll be waiting for you next session. We're going to talk about UTIs in our nursing care facilities or long-term care facilities. Thank you so much and have a great day. Ciao.